Coast Guard has unveiled plans to implement parts of the Brandon Act to improve its behavioral health program. It's part of a continuing military-wide effort to stop suicides. The parents of the deceased Navy sailor for whom the act is named say lives will be saved as a result of the Coast Guard's action. They spoke today to Mike Gooding.
The Coast Guard has unveiled new measures to improve its service members' access to mental health screening and treatment, requiring supervisors and commanders to refer personnel who request an evaluation. Coast Guard Commandant Admiral Linda Fagan did not mention the change in her State of the Coast Guard address this week. But in a Coast Guard-wide message last week, Rear Admiral Dana Thomas, Assistant Commandant for Health, Safety, and Work Life, said the Department of Homeland Security and the Coast Guard fully support the spirit of the Brandon Act and intend to implement applicable elements of it to mature our behavioral health program and reduce suicide-related behaviors in the Coast Guard.
And it shows that all of our military branches really are trying to do what they can on suicide. Is it perfect? No, but it is a step in the right direction.
The 2021 Brandon Act was named after 21-year-old Navy Petty Officer Brandon Caserta, who died by suicide in 2018 after having told his parents he was being bullied at his workplace. Now that the Coast Guard is joining the other branches, the Casertas are pleased.
It's been a long journey, but to get all the services like this is tremendous.
The Army, Navy, Marine Corps, Air Force, and Space Force all implemented Brandon Act policies by September 2023. Mike Gooding, 13 News Now.
And if you're thinking about self-harm or are worried about a friend or loved one, or if you need emotional support, call the 988 Lifeline. It's available 24/7.